Hi, I'm Dr. Michael Kay from the Center for Functional Health, and tonight I'm going to go over two common presentations that we see in the office, and that's IBS, irritable bowel syndrome, and SIBO, small intestinal bacterial overgrowth. Now, many of these symptoms often overlap in these conditions, and that's symptoms of feeling bloated, symptoms of constipation, diarrhea, flatulence, gasiness, and then there's non-gut symptoms such as brain fog, low energy, and skin issues. Now, when it comes to SIBO, which is small intestinal bacterial overgrowth, this is when coliform bacteria from your colon leaks into the small intestine and it begins to wreak a tremendous amount of havoc. To determine if somebody has SIBO, one of the tests that we look at is a breath test. And when we do a SIBO breath test, if it's associated with methane, that means it's usually associated with patients who complain of constipation. If it's associated with hydrogen, that means it's usually with patients that have diarrhea. And sometimes, you know what, it's a mixture of both. Now, when it comes to irritable bowel syndrome is broken up into an IBS-C for constipation, IBS-D for diarrhea, and an IBS-M where it's mixed. And IBS is one of those symptoms that is associated with what we call functional gastrointestinal disorders. Now, according to the Rome Criteria 4, they don't really use the word functional much anymore. Now, when we talk about gastrointestinal disorders, we talk about symptoms and diagnoses of heartburn and reflux and indigestion. And when we're talking about gastrointestinal disorders, we're talking about motility. And when we talk about motility, this is how food moves through your GI tract. And then we're talking about visceral hypersensitivity. These are people that have stomach pain. And then we talk about gut immune dysfunction. That's where they have an altered mucosal and immune function of the microbiota. And bacteria change is where there's altered microbiota. And when we talk about microbiota and microbiome, we're talking about your gut. And then there's altered central nervous system processing, meaning how the brain is talking to the gut and how the brain sends and receives information from the gut. So again, when we look at somebody that presents with a gastrointestinal dysfunction, a gut issue, we're looking at the motility, the way that food moves through the GI tract. Do they have stomach pain? What's their immune system like? Do they have altered gut bacteria? And how well is their gut speaking to their brain? Now, according to the Rome 4 criteria, when we're talking about the diagnosis of irritable bowel syndrome, that's a recurrent abdominal pain on average at least 1 day a week in the last 3 months. And it's usually associated with 2 or more of the following criteria. And that is, it's related to defecation, so this sensation of diarrhea, or it's associated with a change in the frequency of stool or the amount of the stool. So this criteria has to occur over the last 3 months and over the last 6 months to say this person has irritable bowel syndrome. So is there a specific test to say this person has irritable bowel syndrome? Well, Dr. Mark Pimentel, that's Pimental, created this test called IBS Smart. It's a blood test, and we have this test in the office, and we use this for patients who are suffering with a lot of GI dysfunction. Now, this particular test looks for 2 antibodies, the cytolethal distended toxin B and vinculin. Now, if these 2 antibodies are present, Dr. Pimentel's thought is, well, you know what? Somewhere along the line, this person was or experienced food poisoning. So they had food poisoning, and now they may have not felt it right away. Could have been a month later, could have been 2 months later, could have been you ate something, 2 days later you had stomach pain, or you had the runs, didn't really think much of it, but now it's months later, weeks later, and you still have this. So if one of these antibodies come back positive, then you know what, according to Dr. Mark Pimentel, you could have food poisoning, and the treatment for that is an antibiotic known as rifaximin or Xifaxan. Now, if you've been diagnosed with SIBO, possibly your gastrointestinal doctor also gave you the antibiotic Xifaxan or rifaximin. So with these antibiotics, it helps to calm everything down. Now, I know what you're thinking. Don't antibiotics cause gut problems? Well, sometimes, but not always. And in this case, maybe the benefits outweigh the risk. And if you are on an antibiotic and you take this antibiotic and you feel better, great. Then in the office, what we do is support that gut, support you through a good use of probiotics and supplements. So what else can you do if you've been diagnosed with irritable bowel syndrome or SIBO? So one of the things you can do is create a nutrition change, and that's following a low FODMAP diet. And when I say FODMAP, I'm spelling it FODMAP, and that stands for Fermentable Oligosaccharides, Disaccharide, Monosaccharides, and Polyols. So What's an oligosaccharide? So oligosaccharide, wheat, rye, legumes, which are beans, garlic, and onions. So you want to stay away from that. And then the disaccharide, think about dairy and soft cheese, and it's lactose that causes a lot of problems for my patients. So when I get them off of dairy, completely off of dairy, in a week or two, they start to experience a much better gut, meaning less symptom. So that's oligosaccharide, that's disaccharide, and then you have a monosaccharide. So monosaccharide, think about sweeteners, think about figs, honey, agave nectar, that can affect your gut. The A in FODMAP stands for end, A and D, and then polyols. And polyols are your sugar alcohols. So xylitol, mannitol are your ones that people normally see. Erythritol is another one. And then any kind of sweeteners. So all of that, the FODMAP foods can create havoc in your diet, havoc with your symptoms. So what you do is you follow a low FODMAP diet. Now, the clinical presentation that we usually see in the office is this. The patient has been everywhere. They're frustrated. They had a colonoscopy, they had an endoscopy, maybe they had a stool test, they did blood work, and they've been on medication, they've tried different probiotics, and you know what? They're still feeling the same. In fact, some of them have actually been told, you know what? The pain that you're experiencing is actually in your head, and it's just anxiety and depression. It's not that anxiety and depression can't create and cause a problem. It can, but a lot of times we find that when we work with a patient and we work on their nutrition, their lifestyle, and we look at them as a individualized person, that we are able to better, I'm exhausted, I'm done.